Welcome to today's exploration of urethral tuberculosis, a rare but serious manifestation of tuberculosis affecting the urinary system. In this video, we'll delve into the intricacies of this disease, covering its causes, how it develops, effects, its telltale signs, how it's diagnosed, treatment options, preventative measures, and what the future holds for those diagnosed with this condition. Urethral tuberculosis, or TB of the urethra, is primarily caused by Mycobacterium tuberculosis, the same bacterium responsible for pulmonary tuberculosis. The infection rarely originates in the urethra itself. Instead, it almost always occurs secondary to tuberculosis in other parts of the urinary tract, such as the kidneys or bladder. The bacteria travel downwards through the urinary system and eventually seed themselves in the urethral lining. In rare cases, it may occur due to direct extension from nearby infected organs or hematogenous spread, meaning the bacteria travel through the bloodstream. The pathophysiology of urethral tuberculosis involves a complex interplay of immune responses and bacterial proliferation. Initially, the Mycobacterium tuberculosis bacteria infect the urethral mucosa. This triggers an inflammatory response, characterized by the infiltration of immune cells like macrophages and lymphocytes. Granulomas, which are characteristic collections of immune cells attempting to wall off the infection, form within the urethral wall. Over time, these granulomas can cause ulceration, scarring, and stricture formation. The scarring and strictures can lead to narrowing of the urethra, obstructing urine flow, and causing various urinary symptoms. The infection may also spread to adjacent tissues, further exacerbating the problem. Urethral tuberculosis is considered a relatively rare condition, even in regions with high overall tuberculosis prevalence. It typically affects individuals who already have active or latent tuberculosis in other parts of the body, especially the urinary tract. Therefore, individuals with a history of tuberculosis, those who are immunocompromised, such as individuals with HIV, diabetes, or those undergoing immunosuppressive therapy, and those living in areas with high TB rates are at higher risk. Reliable epidemiological data specifically for isolated urethral TB is scarce, as it is often grouped with other forms of genitourinary tuberculosis. The signs and symptoms of urethral tuberculosis can be varied and often nonspecific, making early diagnosis challenging. Common symptoms include dysuria, which is painful urination frequency, or the need to urinate frequently, urgency, a sudden and compelling urge to urinate, hematuria, or blood in the urine, and urethral discharge, which may be purulent or blood-tinged. As the disease progresses, patients may develop urethral strictures, leading to a weak urinary stream, incomplete bladder emptying, and recurrent urinary tract infections. In advanced cases, fistulas, or abnormal connections between the urethra and other organs, may form, causing additional complications. Diagnosis of urethral tuberculosis requires a comprehensive approach. A thorough medical history and physical examination are crucial. Urine analysis is performed to look for signs of infection, such as white blood cells and red blood cells. Urine cultures are essential to identify Mycobacterium tuberculosis. However, it's important to note that TB cultures can take several weeks to yield results. Urethroscopy, a procedure in which a small camera is inserted into the urethra, allows direct visualization of the urethral lining and can help identify ulcers, strictures, and other abnormalities. Biopsies of suspicious lesions are taken during urethroscopy and sent for histopathological examination and TB-specific staining to confirm the diagnosis. Imaging studies, such as intravenous pyelogram, IVP, or CT scan, may be used to assess the extent of the disease and identify other sites of involvement in the urinary tract. While urethral tuberculosis doesn't have specific distinct classifications or types beyond its primary or secondary origin, it's important to consider its severity based on the extent of urethral involvement and the presence of complications like strictures and fistulas. Some classifications may categorize it based on the anatomical location of the lesions within the urethra anterior posterior, or pan-urethral. However, this doesn't fundamentally change the approach to diagnosis or treatment. The treatment of urethral tuberculosis is primarily based on anti-tuberculosis medications. The standard regimen typically involves a combination of drugs, such as isoniazid rifampin pyrazinamide and ethambutol, administered for a duration of at least 6 months. The specific drug combination and duration may vary depending on the severity of the infection and the patient's overall health. In addition to medication, surgical interventions may be necessary to address complications such as urethral strictures or fistulas. Urethral dilation or urethroplasty, a surgical procedure to reconstruct the urethra, may be performed to relieve strictures. Fistula repair may also be required. Regular monitoring is essential to assess the response to treatment and detect any adverse effects of the medications. Preventing urethral tuberculosis relies on controlling the spread of tuberculosis in general. This includes early detection and treatment of active tuberculosis cases, especially in high-risk populations. BCG vaccination, although not universally effective, can provide some protection against severe forms of tuberculosis, particularly in children. Maintaining good hygiene practices, such as frequent hand washing, can help prevent the spread of infection. Screening for latent tuberculosis infection in individuals at high risk, such as healthcare workers and close contacts of individuals with active tuberculosis, is also important. The prognosis for urethral tuberculosis depends on several factors, including the extent of the disease at diagnosis, the patient's overall health, and adherence to treatment. With prompt and appropriate treatment, most patients can achieve a complete cure. However, delays in diagnosis or inadequate treatment can lead to chronic complications such as urethral strictures, fistulas, and impaired urinary function. Recent research has focused on developing more rapid and accurate diagnostic tests for tuberculosis, as well as shorter and more effective treatment regimens. Additionally, research is ongoing to better understand the pathogenesis of urethral tuberculosis and identify potential targets for new therapies. The development of new drugs that are effective against drug-resistant strains of tuberculosis is also a priority. Thank you for watching.